The chronic inflammation and joint destruction associated with rheumatoid arthritis have been linked to the dysregulation of pro-inflammatory cytokines and their associated signaling pathways. How are common pro-inflammatory cytokine signals transmitted into the cell nucleus? RA is characterized by an excess of circulating pro-inflammatory cytokines, such as TNF-alpha or IL-6, which bind to designated receptors on the cell surface and trigger a complex signaling process inside the cell. Different cytokines rely on different signaling pathways to transmit messages to the cell nucleus. For example, TNF-alpha utilizes the NF-kappa B pathway. The importance of another established immune signaling network, the JAK-STAT pathway, is also thought to play a role in the pathogenesis of RA. When properly regulated, JAK-STAT signaling facilitates cell growth, development, and differentiation, especially in immune cells. Working together in different combinations, the four JAKs, Janus kinases, selectively interact with extracellular cytokines via transmembrane receptors to facilitate signal transduction and initiate a response within the cell. These cytokines are involved in immunologic processes, including many that, when dysregulated, are implicated in RA pathogenesis. When a cytokine that signals through the JAK-STAT pathway binds to its receptor on the cell surface, associated JAKs are recruited and activated, which in turn recruits downstream proteins necessary for message delivery to the nucleus. These proteins, called signal transducers and activators of transcription, or STATs, become phosphorylated. The phosphorylated STATs translocate to the nucleus, where they bind to DNA expression sites and regulate gene transcription. This perpetuates the inflammatory cycle. Pro-inflammatory cytokine signaling through the JAK-STAT pathway is thought to contribute to the pathogenesis and progression of RA. First, let's review some important information about RINVOQ. RINVOQ, upadacitinib, is indicated for the treatment of adults with moderately to severely active rheumatoid arthritis who have had an inadequate response or intolerance to methotrexate. The use of RINVOQ in combination with other JAK inhibitors, biologic DMARDs, or with potent immunosuppressants, such as azathioprine and cyclosporin, is not recommended. Patients treated with RINVOQ are at increased risk for developing serious infections that may lead to hospitalization or death. These infections include tuberculosis, invasive fungal, bacterial, viral, and other infections due to opportunistic pathogens. Most patients who develop these infections were taking concomitant immunosuppressants, such as methotrexate or corticosteroids. Lymphoma and other malignancies have been observed in RINVOQ-treated patients. Thrombosis, including deep vein thrombosis, pulmonary embolism, and arterial thrombosis have occurred in patients treated with Janus kinase inhibitors used to treat inflammatory conditions. Patients treated with RINVOQ also may be at risk for other serious adverse reactions, including gastrointestinal perforations, neutropenia, lymphopenia, anemia, lipid elevations, liver enzyme elevations, and embryo-fetal toxicity. Recognizing the important role the JAK-STAT pathway plays in inflammatory cytokine signaling, AbbVie engineered RINVOQ, an oral JAK inhibitor. Based on enzymatic and cellular assays, RINVOQ demonstrated greater inhibitory potency for JAK1 versus JAK2, JAK3, and TYK2. RINVOQ was strategically designed to demonstrate greater inhibitory potency for JAK1 versus JAK2, JAK3, and TYK2. By inactivating JAK, RINVOQ is thought to block the recruitment, phosphorylation, and activation of STATs, preventing the pro-inflammatory cytokine signal from reaching the nucleus, and inhibiting pro-inflammatory processes associated with the JAK-STAT pathway. In clinical trials, RINVOQ has been shown to reduce the pain, swelling, and joint damage associated with moderate to severe RA. RINVOQ exemplifies AbbVie's ongoing commitment to rheumatology and offers an important treatment option for patients with moderate to severe RA in whom methotrexate did not work well. Important safety information. Serious infections. Patients treated with RINVOQ are at increased risk for developing serious infections that may lead to hospitalization or death. Most patients who developed these infections were taking concomitant immunosuppressants, such as methotrexate or corticosteroids. If a serious infection develops, interrupt RINVOQ until the infection is controlled. Reported infections include active tuberculosis, TB, which may present with pulmonary or extrapulmonary disease. Test patients for latent TB before RINVOQ use and during therapy. Consider treatment for latent infection prior to RINVOQ use. Invasive fungal infections, including cryptococcosis and pneumocystosis. Bacterial, viral, including herpes zoster and other infections due to opportunistic pathogens. Carefully consider the risks and benefits of treatment with RINVOQ prior to initiating therapy in patients with chronic or recurrent infection. Monitor patients closely for the development of signs and symptoms of infection during and after treatment with RINVOQ, including the possible development of TB in patients who tested negative for latent TB infection prior to initiating therapy. Malignancy. Lymphoma and other malignancies have been observed in patients treated with RINVOQ. Consider the risks and benefits of treatment with RINVOQ prior to initiating therapy in patients with a known malignancy other than a successfully treated non-melanoma skin cancer, NMSC, or in patients who develop a malignancy. NMSCs have been reported in patients treated with RINVOQ. Periodic skin examination is recommended for patients who are at increased risk for skin cancer. Thrombosis. Thrombosis, including deep venous thrombosis, pulmonary embolism, and arterial thrombosis, have occurred in patients treated with Janus kinase inhibitors used to treat inflammatory conditions. Many of these adverse events were serious and some resulted in death. Consider the risks and benefits prior to treating patients who may be at increased risk. Patients with symptoms of thrombosis should be promptly evaluated. Gastrointestinal perforations. Gastrointestinal perforations have been reported in clinical studies with RINVOQ, although the role of JAK inhibition in these events is not known. In these studies, many patients with rheumatoid arthritis were receiving background therapy with nonsteroidal anti-inflammatory drugs, NSAIDs. RINVOQ should be used with caution in patients who may be at increased risk for gastrointestinal perforation. Promptly evaluate patients presenting with new onset abdominal symptoms for early identification of gastrointestinal perforation. Laboratory abnormalities. Neutropenia. Treatment with RINVOQ was associated with an increased incidence of neutropenia. Absolute neutrophil count ANC less than 1,000 cells per cubic millimeter. Treatment with RINVOQ is not recommended in patients with an ANC less than 1,000 cells per cubic millimeter. Evaluate neutrophil counts at baseline and thereafter according to routine patient management. Lymphopenia. Absolute lymphocyte counts, ALC, less than 500 cells per cubic millimeter were reported in RINVOQ clinical studies. Treatment with RINVOQ is not recommended in patients with an ALC less than 500 cells per cubic millimeter. Evaluate at baseline and thereafter according to routine patient management. Anemia. Decreases in hemoglobin levels to less than 8 grams per deciliter were reported in RINVOQ clinical studies. Treatments should not be initiated or should be interrupted in patients with hemoglobin levels less than 8 grams per deciliter. Evaluate at baseline and thereafter according to routine patient management. Lipids. Treatment with RINVOQ was associated with increases in lipid parameters, including total cholesterol, low-density lipoprotein LDL cholesterol, and high-density lipoprotein HDL cholesterol. Manage patients according to clinical guidelines for the management of hyperlipidemia. Evaluate 12 weeks after initiation of treatment and thereafter according to the clinical guidelines for hyperlipidemia. Liver enzyme elevations. Treatment with RINVOQ was associated with increased incidence of liver enzyme elevation compared to placebo. Evaluate at baseline and thereafter according to routine patient management. Prompt investigation of the cause of liver enzyme elevation is recommended to identify potential cases of drug-induced liver injury. If increases in aspartate aminotransferase AST or alanine aminotransferase ALT are observed during routine patient management and drug-induced liver injury is suspected, RINVOQ should be interrupted until this diagnosis is excluded. Embryo-fetal toxicity. Based on animal studies, RINVOQ may cause fetal harm when administered to a pregnant woman. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with RINVOQ and for 4 weeks after the final dose. Verify pregnancy status of females of reproductive potential prior to starting treatment with RINVOQ. Vaccination. Use of live attenuated vaccines during or immediately prior to RINVOQ therapy is not recommended. Prior to initiating RINVOQ, patients should be brought up to date on all immunizations, including prophylactic zoster vaccinations in agreement with current immunization guidelines. Lactation. There are no data on the presence of RINVOQ in human milk, the effects on the breastfed infant, or the effects on milk production. Available data in animals have shown the excretion of RINVOQ in milk. Advise patients that breastfeeding is not recommended during treatment with RINVOQ and for 6 days after the last dose. Hepatic impairment. RINVOQ is not recommended in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions in RINVOQ clinical trials, greater than or equal to 1%, were upper respiratory tract infection, nausea, cough, and pyrexia. RINVOQ is indicated for the treatment of adults with moderately to severely active rheumatoid arthritis who have had an inadequate response or intolerance to methotrexate. The use of RINVOQ in combination with other JAK inhibitors, biologic DMARDs, or with potent immunosuppressants, such as azathioprine and cyclosporin, is not recommended. Please see accompanying full prescribing information